Should you stop taking your psychiatric medication if you've applied for VA disability? Watch to the end of this video and I'll tell you. just kidding. Don't stop taking your medication. Will this impact your VA rating though? Your VA disability claim? Yeah, I'll talk about it. I'm psychologist Dr. Todd Finnerty, and I provide Nexus letters and psychological evaluations for disability cases, including veterans' disability cases. I used to be a contract CMP examiner, but I'm no longer on the dark side. It's just a terrible joke there. I also spent 19 years as an in-house reviewer on Social Security disability cases, helping to make decisions on those. And I also work on other disability programs like disability insurance, things like that. We're all grown-ups here, so we don't need all the weird legal disclaimers from me. But of course, these are my opinions. They're not necessarily VA policy, though many times maybe there should be, right? The videos are for infotainment purposes only. I'm a doctor, but I'm not your doctor. If I was your doctor, I'd tell you to get off the couch, turn off this video, get outside, get some sunshine, get some exercise. But, since I'm not your doctor, please watch the video all the way through to the end. Like, share, subscribe, right? So I get questions and I see things on the internet, just like you see things on the internet. And lately, people have been talking about the new, the proposed changes for mental health disorders. We'll see what they look like when things finally pan out. But one particular concern was about the proposed changes talking about evaluating veterans, how they are when they take medication. The reality is this isn't really a change. Like if you look at the current mental disorders rating schedule, I mean, right now it's June 2024, so the new proposals haven't been put into effect yet. But on the 10% level, it talks about occupational and social impairment due to mild or transient symptoms, which decrease work efficiency and ability to perform occupational tasks only during periods of significant stress, or symptoms controlled by continuous medication. So the 10% was kind of looking at that. Everything's kind of cool while you're taking the medicine. Obviously, sometimes you take the medicine and things still aren't cool, And then at the 0%, you have a condition formally diagnosed, but symptoms are not severe enough to either interfere with occupational and social functioning or to require continuous medication. So even in the current mental disorders rating schedule, we're talking about the impact of medication. And sometimes the people wonder if people are being penalized for taking medication. Maybe I've seen people talking about maybe they should stop taking the medication or stop taking it before they go to the CMP exam, things like that. Probably not the best idea. You know what I mean? Particularly sometimes, whether or not it should be or it shouldn't be, if you look at some of the research, treatment utilization, like how much treatment you're using, is often used as a proxy for impairment, like one sort of indicator of how bad you are, let's say, is kind of how much treatment you're pursuing, which really not the best, we know. But if, at the same time, if you go in and you're not taking medication, a CMP examiner may wonder why. Well, why don't you need treatment? Why haven't you pursued psychotherapy or counseling? Whereas in other instances, if you need a bunch of psychiatric hospitalizations, if you're like, hey, I need medication, and despite the fact that I'm taking medication, still having trouble, that's very different than not taking medication, right? So if you stop taking the medication, it could also be a bad sign. You know what I mean? From in terms of communicating things. Not to mention the fact that, whatever help the medication was giving you, you're no longer getting. So terrible idea, right? So be careful what you read on the internet or hear on the internet. Not that anyone is advising you to stop taking your medication, but let's not conclude that. All right. Be safe out there, especially out on the internet. Wackos like me out there. Hey, you made it to the end of the video. Thank you. Here's the part where I'm supposed to beg you to click the like button, subscribe to the channel, and perhaps post a comment. But also, you can subscribe to my free email newsletter where I talk about my practice and my thoughts on things related to VA disability claims. You can subscribe to that on my website, nexusletters.com. And if a Nexus letter from a psychologist is something you or someone you know needs, you can get one from me at nexusletters.com. Thanks again. Tisk, tisk, tisk. Don't stop taking your medication. Promise me that, and I'll actually promise to get back to work and work on your reports and get back to all the emails and phone calls that I'm really behind on getting back to. Sorry. It's like I feel guilty about recording this video. It's like